Hello and welcome to the Parenting Challenge for the SAGE Sustainability and Society Hackathon June 2024. I'm Dr. Casper Adiman and I work for the Global Parenting Initiative, which is a large international collaboration looking to provide evidence-based parenting advice to parents all over the world. Within that larger project, my team works on using AI and machine learning tools to try and assess parenting in the first 2 years of life. The ultimate goal here is for psychologists and public health workers to be able to use tools which will help them identify parents who are not coping as best they can, to be able to direct support and advice to those most in need of it. So ultimately the question we're asking here is how well are new parents coping and how could we objectively assess that? So the current best practice gold standard method for doing this is to film the parents' interaction with their babies, just instruct them to play with your child for 5 minutes, and then have trained expert psychologists watch the video and assess things like how good is the rapport between the baby and the child? Is there turn taking and reciprocity in the interaction? What's sort of the emotional tone of this interaction? Is the parent very positive? Do they allow opportunities for the child to respond? What are the child's responses? This very sort of intuitive, qualitative way of assessing how parent and baby interacts does leave a high reliability between expert coders and gives us sort of a simple objective measure of the bond between parent and child, which, as we all know, is sort of absolutely crucial for the foundations of that early life. So the goal of my team is to try and use AI tools to automate some of that type of assessment. And you can imagine that that brings up a huge number of issues to do with data privacy, the ethics involved in that type of assessment, and just the challenge of how do you extract a meaningful signal from a 5-minute long free-form interaction video. So as a starting point, we've taken a smaller data set that's collected for a different study where parents were demonstrating jokes to their babies. And here we're sort of looking at the quality of the interaction, how much the baby laughs, the type of joke the parent is investigating. And this gives us a first stepping stone into the actual bigger challenge that we're interested in. So we had a look at this in the previous SAGE Hackathon, where Ernest's team in London was looking at some of the features that could be extracted from this video. So looking at the location of key points on the bodies of both the participants and their movements over time. You could look at the facial expressions of the baby or the speech that the parent might be making, identifying aspects where the baby is laughing. And it was amazing how much progress they managed to make in just the 3 days of that previous hackathon. Meanwhile, Yu Chen and the North America team looked at how a large multimodal model like Video Llama could be used to watch the video and describe what it saw going on in that video and whether that would be a signal that we could use. And again, it's amazing just how much progress was made in that short period of time. So we're very excited to come back with 2 new challenges for the current hackathon. So the first of those is all about prediction, and that will be led by my PhD student, Jerry Ayock. We've taken those 1,400 videos and we've done the pre-processing. We've got motion capture data, speech recognition data, the facial emotions for all of those videos, together with these labels of what joke was being performed, how funny the babies found it, whether they laughed, yes or no. And the challenge here will be to build some model that links that data with those labels. Can you make predictions about those videos? Within that also we might want to look at can we improve on the levels of emotion recognition that we're achieving, or maybe go further with that rich video description as these large multimodal models have improved since we last looked at them. The second and perhaps harder challenge is how you turn a model like that into a product. And this team will be supervised by my PhD student Irene Uwerikowe. And our question here is, like, assuming that we have a model that approaches human level performance on this classification of parenting, how can we turn that into a product for public health sector workers working in low resource communities and settings? So the questions here are who are the stakeholders, who are we building this for, what are the ethical challenges of creating something like this, the data security issues to do with the initial training data, can you make a public version of that, and then data security as the product is being used. What does the user interface look like, and where does the human come into the loop when you're making these assessments of something so sensitive as parenting styles and quality? And then what sustains this as a product? What is the business model behind creating this? So those are the challenges. We hope it gives you a good sense of how AI solutions can be used in social and sort of public health settings. We'll be working with some real data and the real challenges that our work is involved, and we'll get you involved for get your perspective on that. And I think one of the nicest things about this project is just how global a perspective it is, relating to something which is the same all over the world. The important aspects of early life and the care and love that parents can bring. And we look forward to seeing what solutions you provide us with.